today for the August webinar. It is my honor and pleasure to introduce Michelle Lane, and she will be speaking on dynamic seating, protecting both client and equipment from harm. Good morning, Michelle.
Good morning. Thank you very much, Beckett. I appreciate it. And thanks, everyone, for making time in your busy schedule to join us for the webinar today. I'm Michelle. I'm an occupational therapist in the Denver, Colorado area, and I've been working in the area of seating and mobility for a lot of years now. And really one of my favorite niche areas of wheelchair seating is dynamic seating. I've been playing with dynamic seating for a lot of years with my clients. Fortunately, in the last handful of years, we've had a lot more product options available to us instead of trying to make things work with what we have in the closet. So it makes it easier for us to apply this with our clients. So this particular webinar is sponsored by Seating Dynamics, and they do make a number of dynamic seating components. I do some consulting work for them. I am in private practice and work for a number of different organizations, and I also see clients some of the time. So I am going to attempt to provide this information as objectively as I can, as I do use a variety of dynamic seating applications. We have some learning objectives here. This is a CEU approved course. First, the participant will be able to define dynamic seating. Second, the participant will be able to list 3 clinical indicators for use of dynamic seating to reduce client injury. And third, the participant will be able to list 3 clinical indicators for use of dynamic seating to prevent equipment breakage. So in this webinar today, we're going to quickly define just what is dynamic seating, and then we're going to discuss how dynamic seating can reduce client injury and prevent equipment breakage. We had a similar webinar, a complementary webinar in June that Beckett briefly mentioned earlier that dealt with other aspects of dynamic seating. This particular focus here again is on preventing injury to the client and the equipment itself. And towards the end of this webinar, I'll have some information about the other webinar if you're interested in getting that information as well. So just what is dynamic seating? Depending on where you look for that answer, you might see a variety of different definitions. Dynamic seating can be used in a number of different ways. But for the purposes of this webinar and the area of technology we're focusing on, we're going to use this definition here. Dynamic seating is movement which occurs within the seat and/or the wheelchair frame in response to forces from the client. The dynamic components move, and as they move, they're absorbing forces from the client. Those forces then in turn assist the client back up to their starting position. That's a very important part. Otherwise, we could make something that moves like you see in this picture here, but there may not be anything to help this young lady return to upright. So that's a critical part of dynamic seating. Dynamic seating has a number of goals when we're using this technology with our clients. We're allowing movement for the client. That's a big one because our clients need to move. I need to move, and it's nice to have that opportunity within the seating system. We're diffusing forces. Let's say someone's using excessive force when they're in their seating system, whether it be sustained or intermittent forces, those are absorbed. And the webinar back in June actually addresses those first 2 goals, where we're using dynamic seating to allow that movement and diffuse those forces. We're talking today mostly about our 3rd goal, and that is protecting the client, the seating system, the mounting hardware, and the mobility base. A 4th goal that we're not discussing today and that we do not have as much evidence for is to improve postural control. This is something that I'm really excited to see if we can develop more evidence for in the future. We know from other therapeutic applications that if we allow someone to move within a limited range, we often can see an improvement in muscle strength. And I have had reported to me by a number of colleagues that they've worked with clients who have used dynamic seating and seen an improvement in their postural control, in their trunk and head control in particular. Of course, that's going to be dependent on the potential of that client to make those gains. Again, today we're focusing on the goal of protecting the client and the equipment. So protecting the client. If the client is exerting enough force to break things on their chair, then injury is very possible. And this is an area where I'm sorry to say this was just not on my radar for a long time. So we were anxiously looking for dynamic options to diffuse these forces to keep our clients from breaking their equipment. Clients who were continually snapping things off the back, breaking footrest hangers, snapping a headrest, clearing off the chair. So we were looking for dynamic seating to address these issues, but not necessarily keeping in mind the injuries these clients were sustaining themselves. We know that there's a lot of research right now about concussions, and we're going to talk about that here in just a minute. I'm convinced, even though we don't have the direct evidence yet, that if a client can contact their head support with enough force as to break it, that they are probably exerting enough force against their brain to cause a concussion, and at the very least, micro concussions. Micro concussions are a big deal in the media right now, a big concern about kids in sports. Again, we'll touch on that in a minute. And there are certainly other injuries that can occur to the client when the client is exerting these forces against the chair, either due to the forces that are not diffused, or as a result of causing damage to the chair that then puts the client at risk of injury. Again, we're also protecting the seating system, mounting hardware, and the frame itself from damage. So just what does the research say about this? It's easy for you or I to share our clinical experiences, and I think those are quite valid. However, we know that a lot of folks out there, especially funding sources, are going to say, do you have anything to back those claims up? Well, we don't have as much research as I would like. Not all of it is as recent as I would like, but we do have research available to us. This is one study that was done in 2010, and it compared, using some pretty sophisticated technologies, the impact of using dynamic seating versus non-dynamic or rigid seating. So they used movement analysis while the person was extending within their chair. They found that there was a decrease in overall extension, that decreased extensor thrust. That's good. That means we're reducing those forces. They also found increased range of motion. Well, that was pretty apparent, meaning that the client could move back and forth where before they couldn't. They also found decreased vertical trunk movement during extension. When someone's in a rigid system and they're pushing against it, you know how they kind of stand up in their chair? Their back moves upward within their seating system during extension. That wasn't happening. The pelvis was staying where it should be instead of going up the back. They also noticed a decrease in upper extremity movement, and the study speculated that that was because the client did not have to stabilize as much with their extremities because they were finding the stability they needed within the seating system. So bottom line for our goal here today is that decreased extension as a result of dynamic seating meant decreased force against the client, hopefully reducing risk of injury, and the components reducing risk of damage. This study was done in 2007, and it looked specifically at using dynamic seating to reduce wheelchair seating discomfort. They found in this study that dynamic seating resulted in a decrease in spasticity intensity and in contact pressures. So all that pressure that the client is exerting against the surfaces of the seating system and subsequently the frame. They found that the clients had better stability to their posture and increased comfort. Now, we know comfort is not always our best word when it comes to funding, but the opposite of comfort is pain, and pain is a concern and something that we are supposed to alleviate medically. I actually wrote a recent blog on this that you can find on the Seating Dynamics website, and I'd love it if you read that and add some comments. We're really starting to get a discussion going about this issue of pain versus comfort. They found an improvement in functional aspects, meaning the person was more functional, and that there were decreased damages seen to the seating system. They also found the client was vocalizing better and breathing better, which was great. So bottom line for what we're talking about today, there was less damage to the seating system when dynamic seating was used. This study was done in 2003 in Italy. There is more dynamic seating happening in certain areas of the world, a lot of dynamic seating happening in Europe and Australia and Canada, where funding is a little more readily available for this technology, and there's also a wider variety of product options. They found that a dynamic seating system led to a decrease in the intensity and duration of extension. So imagine someone sitting in their chair, they're extending against the seating system. The intensity, the magnitude of that force was not as high in using dynamic seating, and the duration of time the client continued to extend within the seating system was reduced. So decrease of that extension pushing movement at the trunk and head. They also saw less hyperextension of the head during this increased tone, less involvement of the lower limbs, so the lower limbs weren't pushing as much either. And there was, this next sentence is a little confusing because of the language barrier, but basically the client was staying in alignment with the seating system. So if somebody is really extending within their seat, often we see quite a bit of shear. They're moving across the surfaces of the seating system because the seating system isn't moving with them. So this posture was maintained. There was also less energy exertion from the patient and an improvement in swallowing and less secretions. Talking about our goal here today of reducing client injury and damage to the wheelchair, this means a decrease in the intensity and duration of the extension, decreased force against the client and the components. There is, fortunately, more literature than I realized out there on this topic, and I just recently updated the literature review that I started a couple of years ago, and this is available on the Seating Dynamics website under resources, and once you get to the resources page under downloadable information. But it's an extensive literature review, including peer-reviewed journal articles, articles that are available in other publications, and then proceedings and presentations that have been made on this topic. I think even included in there is some patent information that's been completed in this area of dynamic seating. So feel free to look at that. It has a date on it, so if you're really interested in this, you want to see how this has changed, maybe someone is challenging your thoughts on dynamic seating, you can always pull this up and reference it in your documentation. Just check and make sure you have the latest version of this. I hope that over the next 5 years we have more research on this topic. Questions so far as we go through some of this dynamic seating info. If you have a question, feel free to type it in the chat box, or if you have any comments, type those in there at any time. If I don't answer you right away, it's perhaps because I know I'm going to be addressing this fairly quickly, so hang in there, or I will get to it at my next little break. We can also take questions at the end of the webinar as well. So again, if you have any questions or comments, feel free to type away. I'll keep my eye out on that box. So let's talk a little more about preventing client injury. Injury within a wheelchair and seating system can occur from sustained forces against unyielding surfaces. This is often the result of high muscle tone. So someone is pushing into that unyielding surface and sustaining force against it. We also can see repeated impact forces, these intermittent forces, in people who have high muscle tone as well, and repeated impact forces by clients who tend to rock. So sometimes we have clients who are really seeking out movement and can rock with a great deal of force, even if perhaps they do not have a lot of increased muscle tone. This can still result in damage. So this young man in this picture, well, he's a young adult now, he is in a kid rock, and this is no longer available. You can see that he is definitely extending in this. He has come to pretty much a fully straight position, and it's up to that dynamic seating system to assist him back into a starting position in a seated position. But he is perfectly capable, because of his diagnosis of cerebral palsy and a great deal of extensor tone, of assuming this position and sustaining this position for a long amount of time. This young man, before he received dynamic seating, had repeatedly broken his equipment. Injury can occur from contact with broken components if breakage occurs. So if somebody suddenly, with a strong amount of force or sustained forces, breaks something within their frame or seating system, sometimes that can result in injury. There can be sharp edges of things exposed, hardware exposed, or just a support that has collapsed and given away. Any of that can lead to client injury. Some of our clients use such large or forceful movements that they bounce their chair across the room, and sometimes this can result in the wheelchair tipping. The client can then be injured during that tippage, and there can certainly be a combination of these factors. We can also have injury that occurs just from these sustained forces. That amount of force can lead to injury of various areas of the body. This can include the head, the brain specifically, and other injuries. So let's talk more about the head. This gentleman here moves a lot throughout his day, and a lot of his movement is at the head. Now, it doesn't look perhaps in this video like he's exerting a lot of force, but he is. Behind that large pad is quite a bit of hardware, and that's because he has repeatedly over the years snapped off various head supports. He has a nice big bald spot on the top of his head from repeated contact with this surface. So the client may be injured by significant forces, the magnitude of the force, and repeated forces against the head support pads. If the client actually breaks something on there, and I have had lots and lots of clients break some of their head support hardware, imagine what that force is doing to the cervical area and the brain. If I sat in this chair that this gentleman is sitting in and tried my very best to hit my head against that support as hard as I could over and over and over, I don't think I have enough strength. I know I don't have enough strength to break that off. But I have had very young clients sometimes, clients who do not weigh very much, who have significant forces, enough that they have literally snapped clean off the mounting hardware on a head support. Now, right now, and I wish I had those results, but I do not, a colleague of mine, Suzanne Eason, who is in Virginia, she works at a location, a residential facility, and is working in her spare time at placing some pressure maps, some smaller ones, across the head surface of several of her clients who have broken hardware in the past, to get a better sense of just how much force are some of these clients actually exerting against the head pad. Because we do have research that lets us know how much force is required to create a concussion. We just don't know how much force someone like Philip here is actually exerting during these movements. We know that a concussion can occur when the head collides with another surface. There's lots of research out there, obviously, around sports. So when two football helmets and the heads within collide, there's a certain amount of force that's generated. When our clients collide with this unyielding surface, there's force generated as well. Lots and lots of research around this lately, and some of the research is more recent than this particular study. But this study in 2010 kind of set a bar of thought in terms of what amount of force is required to actually generate or create a concussion. And that was 95 Gs of force. The studies have shown that an average football player receives 103 Gs when hit during a game. That exceeds 95, and that means that this client can actually get a concussion during these hits. And so obviously there's been a lot of design going into these football helmets to try to diffuse some of those forces. Now, this isn't the same as dynamic seating, but again, dynamic seating, a lot of what we're doing is diffusing forces. Some clients we know are impacting their head pad with enough force to actually snap off the hardware. The degree of force, the amount of force, and repetition of force increase risk of injury. So it's not so much that football player colliding with another football player once with a lot of force, though that can certainly create a concussion. The concern is that these hits are occurring over and over and over. Whoops, let me go back here. There's been a lot of interest very recently in subconcussive blows. So recent research, and you can see one cited here as recently as this year, has indicated that repeated impacts, even in the absence of concussion, so at a force that doesn't quite create a concussion, repeated impacts can still lead to brain injury. There's more research going on here, and this is really directing where we're going with certain sports, especially youth sports right now, sports like football and soccer, and realizing that even if this child, this young person, has not received an actual, what we would define as concussion, that these micro concussions or subconcussive blows, when added up over time, can still lead to brain damage. There's other injuries that can occur as well. When someone is moving within their wheelchair and those forces meet unyielding surfaces, the seat, the back, the foot plates, that leads to a buildup of force in the joints of the client. There can be extreme forces that are occurring through joints such as the knees, the ankles, the hips. We already know that research shows that people with cerebral palsy are much more likely to develop arthritis at a younger age in comparison with the rest of the population. Why? Well, it's because of joint stress. You know, if we live long enough, all of us will develop some degree of arthritis. It's just from wear and tear on our body. I know it's a bit depressing, but we all have some wear and tear on our body, and our clients who are exerting these forces through their body are increasing that wear and tear significantly. So again, we know that people with certain medical conditions are developing arthritis because of these forces through their joint at a younger age. We can extrapolate that these huge forces within a wheelchair seating system, where those forces are not diffused, are creating a lot of force through joints, a lot of stress in those joints. All right, so I'm going to illustrate this, the brief case study, but first we have a question here. Let me see. All right. Here we go. This is from John, and John has said, having current issue with Medicare funding dynamic leg rest as the code being used as a rented item. Because of bundling, we are not able to fund with Medicare, and secondary is following Medicare closely. I suggested that we have to wait until the rental period is over to access secondary funding down the road. We're going to touch on funding in a little bit here, John. It is tricky, especially with Medicare. So thanks very much for that question, and I will get to funding towards the end of the webinar. So hang on to that. Definitely need that input. I'd love to talk to you more about it as well. So getting back to client injury and how this can occur within a wheelchair seating system. This is Daniel. He has cerebral palsy. When we were first looking at dynamic seating with Daniel, he was 9. He's much older than that now. He was in a manual tilt and space wheelchair with a linear seating system. Despite his small size, he had a tremendous amount of tone. He was routinely breaking seating components and had injured himself. He did receive a baclofen pump, and tone management, the medical advances in tone management, have helped greatly reduce the need for these interventions. However, we still have clients that can exert high forces at times, even with tone management. And in Daniel's case, despite the baclofen pump, he could not tolerate a very high dose at all because it would lower the seizure threshold. So if we raised that, well, I wasn't raising it, if the doctor, the medical team was raising the dose of baclofen, his seizures would start breaking through, and so we had to reduce that, less control of his tone. Here's the list of injuries that have occurred over the years with Daniel due to this strong extension that he was exerting over the years. He has dislocated both of his elbows. We anticipated this. As a result, when he was much younger, in the picture we saw previously, we were very much considering strapping his arms down to his arm pads to keep them in some degree of flexion when he was in his wheelchair. His physician was worried that he would literally break his arms, as were we. And so we did not strap his arms, and he subsequently dislocated both elbows. He sustained a hairline fracture of his lower right femur. The doctor was convinced, as was I, that this was due to his constant extending against unyielding surfaces again. He had tendon tearing on both sides below and to the side of his knees due to this huge amount of force within the knee. His knees were always red and swollen. And even though Daniel did not indicate that he was in pain, he is nonverbal and uses a speech-generating device, we assume that there had to be definitely a degree of pain going on with all of this. He was diagnosed with Osgood-Schlatter disease, which does make someone more prone to some of these conditions at the knee, to damage around the knee. This was not a good combination to have with the amount of force that he was putting through his knees. His primary diagnosis is cerebral palsy. The orthopedist recommended that we increase his knee extension in sitting to reduce the forces through his knees, but it still wasn't enough. So we did recommend finally a Kid Rock. That did help quite a bit until he outgrew it, and the Kid Rock has been discontinued. Daniel has been using a more recent history, a tilt and space wheelchair with a seating dynamics rocker back and dynamic footrest, and he's been using this very successfully for a number of years now. He recently graduated from high school. Since he began using these dynamic components, he has had no new injuries, and his knees are no longer red and swollen. He seems to be much more comfortable. His caregivers are very happy and believe that this is something that's been very successful for him. One thing that his caregivers will tell you, and I find this is very common in dynamic seating, is that they would never, ever, ever go back to static seating. They're used to dynamic seating. It works for Daniel, works for them. I want to show you this video. This is Daniel showing off his tone. He doesn't happen to be wearing shoes in this video. He usually is. He's watching the Rockies game. He loves baseball. He's a big Rockies fan, and he gets very, very excited during them. You can see before I even start the video, he's definitely got his seat to back angle open and his knee angle open. He has already activated these components. And if you watch the back, watch that seat to back angle and his knees, you'll see movement occurring in both of these as he extends. So those feet are slowly sinking down. The seat to back angle is closed a little bit, and there he goes again. It's a commercial. It's not so exciting. So the movement that we see in dynamic seating is not always the same movement we would see if you or I sat in that chair and tried to move it. We sometimes see these more subtle movements where there's a slower movement at times into a more open or extended position, and then slowly returning more to a neutral position. And that's what happens with Daniel. What I have noticed, and I've had a lot of colleagues notice, and this might be your experience as well, is that if those surfaces don't move, if someone by chance locks out the back on Daniel's dynamic system, which is possible to do, once he hits that static wall, that unyielding surface, he'll push into it and his tone will increase, and those forces as a result increase even more. Oh, we already saw that. There we go. All right, we have a question here from Julie. She has asked, are you seeing many neck injuries as well as microconcussions? You know, that's a great question. What I worry about with my clients who are exerting a lot of force before we started putting dynamic components like behind their head, for example, is that I don't know, because I'm not measuring the amount of force that's occurring when they are colliding with their headrest or sustaining force against the headrest. So since we're not doing MRIs or not actively measuring those forces yet behind their head, I can only assume that many of my clients are exerting enough force that they could be creating a microconcussion, if not a full concussion, but I have no idea, and I wish I did. In terms of neck injuries, same thing. I can only guess that if someone's pushing against their head pad with that much force, it's putting a lot of strain through the cervical area. I do have some clients who are extremely tender in that area. Clients who perhaps are really stuck in a lot of hyperextension, and perhaps I've placed my hands behind their head or their neck and I'm trying to flex them forward, and they respond in a way that they're indicating a lot of tenderness in those areas. I have in my own observations seen clients who that tenderness seems to go away once we put on dynamic components, but I don't have any evidence of that at all. I wish we did. So again, I would encourage everyone on this webinar, if you're working with clients and they don't have dynamic seating yet, look for some of these indicators that there could be, injuries perhaps that we're not seeing. And then if you begin using dynamic seating with them, see if that changes. I'm not in a great position personally to be doing a lot of formal research in my practice right now, but I certainly can write up a case study about an individual, and we are slowly collecting case studies right now, and that helps to build a body of evidence about the impact of this. If you're working with a client and you think they could be a beneficial case study, but you don't want to write it up or you don't have the time, contact me. I'd be happy to set up a phone call and just talk it through. And a number of the case studies we have, that is exactly what's happened. Someone has contacted us. I've researched the case and talked to everyone involved and written that up as a case study so that we can better document what the impact is of dynamic seating. All right, any other questions or comments people have at this point? We'll go ahead and answer those as soon as I see them in the chat box there. So we've talked some about preventing client injury and how those injuries can occur if we do not have dynamic surfaces that move in response to that force, and what some examples are of some of those injuries. Let's talk now about preventing breakage to the equipment itself. Breakage can occur in a lot of different areas. If you work with clients who are exerting a lot of force or have just a lot of strong repeated movements, you have seen this damage, right? Feel free to type in the chat box what you've seen your clients do to their equipment. But breakage can occur at the footrest hangers and foot plates. The client is able to get a lot of leverage under their feet during extension and really generate some significant forces in that area. The back canes, because we have extension at the hips that is pushing against those back canes. A lot of my clients have very creaky chairs. You can sure hear them as they're moving within their seating system. Everything's creaking and moaning under these forces. The seat frame itself can break. The hardware that's mounting the seating system to the chair and the head support mounting hardware, these are all areas that are particularly prone to damage. Pictured here, this is a back, just a wooden base for a linear back, and it's got a series of T-nuts in it to attach components. Well, where it broke here, that's where the lateral was attached, the lateral trunk support, and this person was repeatedly banging against this with so much force that it absolutely broke through this wood base. So breakage can be due to sustained forces, intermittent forces, repeated forces, and really, really strong forces. And we can see a combination of all that with our clients. Many of my clients show times where they lean into their equipment and hang out there for a sustained amount of time with a lot of force. That same client might show those intermittent bursts of force. Some clients really show repeated forces who tend to rock. There's also forces that tend to occur in more than one plane. So a lot of our clients have complex movements. They're not just pushing straight back, let's say, on the back of their seating system, but they're rotating. And those forces can really be devastating to the equipment. Here with this young lady, we'll look at this again on another slide in more detail. This component on the side of her footrest is supposed to be straight, and she has bent it quite handily due to sustained forces. If the equipment breaks, the client may not be able to use their wheelchair or seat until repairs occur, and we know that can take some time. For a lot of our clients, that means they're in bed, and we know research has shown us over the years that there are devastating consequences to our clients from spending too much time in bed. Respiratory issues, lack of strength, lack of range, loss of range, pressure changes, etc. It can be an increased burden to the caregivers who now have to take care of this person without the benefit of their mobility base, and the person who's now out of their wheelchair is missing participation in school, work, other settings. There also can be real funding difficulties when we keep asking for repeated replacement of components. I have certainly had funding sources say, wait a minute, we already paid for that head support. And I have to tell them, I know, they broke it again, and we have to replace at least some of the component if that has occurred. This is Eddie. Eddie is in his late teens. He has cerebral palsy, and he has a lot of force. I don't work with Eddie. We happened to find a video that his mom had posted on YouTube of him using a dynamic seating system. He has been using it for a number of years, and before that had broken quite a bit. He and his family live in Illinois. So he has broken his back where the laterals attach. We saw this picture before. So right where those lateral trunk pads attach, he has snapped that right off. He will frequently throw himself back in the chair, and as a result has snapped various things off of this base, and sometimes as a result can't use his chair. He has a tremendous amount of seizures, and his seizure activity can lead to some strong movements as well. And he has responded very well to having movement available to him during those seizures. This is Kylie rocking her cool hair color here. She is very interested in the theater and is often in charge of casting people for productions. And she was rocking this blue because she was working on Frozen. She has bent these springs that are designed to rotate. These springs are often placed between the footrest hanger and the foot plates to allow the foot plates to rotate outward. And part of that is if the edge of this foot plate whacks into a door frame, for example, this will take the heat instead of the footrest hanger. But she has pushed with such force against these, with sustained forces, that she has repeatedly moved the foot plates completely out of position, but also bent these absolutely into a C on both sides. These are made out of steel, folks. I do not know how she's done this. This is an incredible amount of force. So again, do I know if she has created damage to her ankles, her knees? I don't know. All I know is there's a tremendous amount of force going through her ankles and knees in particular, and I'm worried about that, as well as I'm worried about damage to the components. This is Joe. He also has a lot of force. Now, Joe's one of those guys that sometimes sits kind of quiet, and you might look at him and think, he's fine. He certainly doesn't need dynamic seating, until something sets him off, and then huge, huge tone. Now, Joe actually has a dynamic back, and he has broken this dynamic back. He has worn the round holes within this mechanism here into ovals. This entire mechanism here, when I first saw it, was covered in a fine silver powder, and it was from the aluminum from him actually wearing it out. So when he was moving in his system, and I wish I had a video of him doing this, when he was moving in his system, instead of activating the elastomer here, as he should have been. That's what's supposed to absorb that force and help the client return to neutral. He was simply finding movement between the bolts and the holes, and this whole thing was about ready to explode. So we had to order him something that was more durable because of his strong and repeated movements. So those are some examples of common areas where we can see breakage to the wheelchair, the seating system, the mounting hardware. I'm sure you've seen other areas of damage as well. Again, feel free to put them in the chat box. But very important to see if this client may be appropriate for dynamic seating to diffuse those forces so that there's no further damage. While people are typing, I'll give you another example. I work with the young man named Austin. He's an adult as well. Austin used to break about 2 to 3 headrests a year. Absolutely break them. Since he has had a dynamic headrest, this has absorbed those forces. He has not been able to break a head support since. It's been, I think, over 5 years, a world record for Austin. So certainly from a cost effectiveness standpoint, it was great for him. That doesn't always ease our seeking out funding, but really helped. And instead of not having the ability to use his wheelchair when he broke his headrest, and sometimes really ending up with a severe hyperextension over this broken head support when it first occurred, he's able to use the same head support. All right, I'm not seeing any questions right now. If you're typing, please keep doing so. Again, we'll have time at the end as well. You know, talking about preventing client injury and equipment breakage, we have to talk about durability, because if a client is capable, if they have enough intermittent, repeated, or sustained forces to break the wheelchair frame, the seating or the mounting hardware, then this dynamic seating component has to be stronger than the original equipment. And since the component moves, that makes this really difficult. It's hard to design something that's stronger than the original equipment and that needs to move. So we need something that's very, very durable. This is an example of a dynamic component that unfortunately wasn't durable enough for a client that had a lot of force. They have trashed this out. So they have rounded out, enlarged various holes on here. Some of these have been quite distorted as a result of the forces that were exerted. So it's important to keep in mind the durability of the component itself. This is still a relatively new area of wheelchair seating and mobility, even though some dynamic components have been out there for a while. And to my knowledge, very few, if any, of these dynamic components have really gone through durability testing. It's something that I hope that we see in the future, so that we have a better sense of just how many repetitions under force can this component endure before there is a failure, so that we are better informed in terms of durability of the component. Maintenance is often required on these components because they are taking a great deal of force. So depending on the dynamic component, we might have to replace certain aspects of it. So in this picture here, this is an elastomer that's used in a seating dynamics rocker back. And on the right side here, this is a brand new elastomer. They come in different strengths, different amounts of resistance. This is their clear one. And you can see that a client, this is a client in the Illinois area as well, who is a client of Jill Sparacio's. This client has absolutely thrash this poor little elastomer. So over the period of probably about 18 months, this client, because of greatly exerted forces on this, has compressed, and actually you can see the changes in the material itself. It's really quite fascinating. So it's important that we get in there and check periodically. I recommend at least once a year to make sure that there's nothing in there, springs or elastomers. Each manufacturer has a different means of providing that resistance, to make sure that nothing needs to be replaced due to maintenance. In this case, and actually one of the blogs on Seating Dynamics is an interview with Jill Sparacio. Feel free to look it up. And she talks about this very scenario. With this client, she noticed the client's position was deteriorating somewhat, and it was because this elastomer on the left is shorter and the seat to back angle was more open as a result, and it was impacting this person's posture, and the dynamic component wasn't doing its job as well as it used to. Once this was replaced, no problem. Important to look at resistance as well. How do we determine how much resistance to put into a dynamic component? You can see this one moving up and down a little bit. In general, if the client can't readily move the component, If it's just not moving at all, then we know the resistance is probably too high. In general, if the client cannot readily return to their starting position, come back to upright, the resistance might be too low and they're able to stay at that end range. It might be too, if the client can't readily return, that the component needs maintenance. Perhaps that elastomer needs replacement. Here, if you could see my mouse here, this is where the elastomer is in this particular dynamic component. And it looks like the color's right and it's readily moving up and down. Sometimes what I notice when this needs to be replaced is as the client is extending, this elastomer is being compressed, that it will bulge out, kind of like a bulging disc in our back. If I see that, I know that it most likely needs to be replaced. And then funding. John, you mentioned this earlier, and funding is always a huge issue. So can we get this paid for? Of course, it depends on the funding source, and our documentation is very, very important. For sure, Medicare is most difficult, and it's something that would be actually a great blog topic, is what are our options when we're dealing with Medicare particularly. I've had some very good luck with non-Medicare funding sources, state Medicaids, private insurance. Oftentimes will pay for this equipment, but it does require correct documentation. And part of the challenge is that funding sources may not know what we're talking about. So if I say my client needs dynamic seating, they may not know what dynamic seating is. So part of my documentation is educating that source to let them know this is what dynamic seating is. This is why we're recommending it for a client. This is what I see in my client now, and this is my goal in using this. It's very hard with most funding sources to be able to send video. I've certainly tried, and it's again challenging through still photos to demonstrate why we're recommending dynamic seating. To help with this, I've written up some sample medical justification wording, and you can find this for various dynamic components on the Seating Dynamics website. Please know this is not just for Seating Dynamic products, it's for any dynamic component, and there are specific sample wording in there for dynamic components at the head, at the back, and at the footrest, since that is where we typically have those interventions. So feel free to look that up, to download it, use it in your documentation, just customize it to match your client's needs. And John, I am going to explore that Medicare situation further, and I'd love to talk to you more about it because it is something that we need to keep working on. There are definitely challenges in the world of dynamic seating, from coding to reimbursement. All right, I want to open us up for questions. We have some time here at the end. We have a good 5 minutes here to take any questions or comments people have. While people are typing those in, I want to kind of reinforce what we covered here today. Remember, dynamic seating provides movement of the seating component and or the frame, and that can protect the client from undue forces. Dynamic seating can absorb those forces, diffuse those forces, and that can protect the seat and frame from damage. It also protects the client themselves. Mentioned before that there's some other dynamic seating webinar resources. Back in June, on June 19th, we did a dynamic seating webinar on diffusing that force and allowing movement for our clients, and that's available on demand through the Numotion website. I also recorded a more general overview of dynamic seating that talks a lot about various product options as well. That was recorded in January of 2017. If that's something you're interested in, we may be able to get that recording to you as well. Just contact myself or Beckett. Also wanted to list a number of resources for you. On the Seating Dynamics webpage, I write a blog that comes out about every 2 weeks, and love to have you read those and comment on them, give me suggestions for for other blog topics, that would be great. There's a lot of information there. We also have under resources a decision-making tree for dynamic seating, clinical indicators for dynamic seating, a literature review that we talked about earlier, and that sample medical justification wording. And I want to thank everyone again for attending this webinar. Hang on a little longer. I want to make sure we can address any questions or comments you have. And I want to provide contact information for Numotion, for Seating Dynamics, and for myself. So again, type in those questions and comments. I am at your disposal.